Hey everybody, this is Robert and welcome to today's infectious disease news brief. Now on the website outbreaknewstoday.com, we have been following the measles outbreak among the Orthodox Jewish community of Williamsburg, Brooklyn since mid-October when the first cases were reported. And a lot has happened since then. Since those first cases, New York City health officials have seen nearly 300 confirmed measles cases, primarily in several Brooklyn neighborhoods and a few cases in Queens. The outbreak has really heated up, as by the end of January this year, there was only 64 cases. Today, it's 285, with 228 of them being in Williamsburg alone. Now, children account for 246 cases, according to health officials. 39 were in adults. And most of the patients that were being treated were either unvaccinated or incompletely vaccinated. There have been no deaths in this outbreak. However, 21 patients had to be hospitalized for their illness, and 5 were actually admitted to the ICU. Now, this may explain the move by New York City Mayor Bill de Blasio and the Health Commissioner, Dr. Cyrus Barbeau, when they decided to declare a public health emergency on Tuesday. Now, part of this declaration is what some would consider controversial: mandatory vaccinations. Now, according to the order from the commissioner, and I read, the measles outbreak persists in Williamsburg despite other efforts taken by the Department of Health and Mental Hygiene to stop it, including orders excluding unvaccinated children from attending preschools and daycare programs, because a high rate of people living within Williamsburg have not been vaccinated against measles. And pursuant to Section 556 of the Charter of the City of New York, the department is responsible for controlling communicable diseases within the City of New York and for supervising the abatement of nuisances that affect or are likely to affect the public health. And pursuant to Section 3.01 of the New York City Health Code, I am authorized to declare a public health emergency and issue orders and take actions that I deem necessary for the health and safety of the city and its residents, when urgent public health action is necessary to protect the public health against an existing threat. And I find the ongoing measles outbreak in Williamsburg to be an existing threat to public health in the city of New York. And I also find that the presence of any person in Williamsburg lacking the MMR vaccine, unless the vaccine is otherwise medically contraindicated or such person has demonstrated immunity against measles, creates an unnecessary and avoidable risk of continuing the outbreak and is therefore a nuisance, as defined in New York City Administrative Code 17-142. And pursuant to New York City Health Code 3.07, no person shall do or assist in any act which is or may be detrimental to the public health or to the life or health of any individual, or shall fail to do any reasonable act to take any necessary precaution to protect human health and life. It is hereby ordered that any persons who live, work, or reside within the following 4 zip codes, 11205, 11206, 11211, and 11249, and who have not received the MMR vaccine within 48 hours of this order, remember this order was issued April 9th, being signed by me, shall be vaccinated against measles unless such person can demonstrate immunity to the disease or document to the satisfaction of the department that he or she should be medically exempt from this requirement. It is further ordered that the parent or guardian of any child older than 6 months of age who lives or works and resides in these 4 zip codes and who has not received the MMR vaccine within 48 hours of this order, being signed by me, shall cause such child to be vaccinated against measles unless such parent or guardian can demonstrate that the child has immunity to the disease or document that he or she should be medically exempt from this requirement. They're not playing, folks. Even the mayor said it's time to take a more muscular approach. Now, those who have not received the MMR vaccine or do not have evidence of immunity may be given a violation and could be fined up to $1,000. Now, Mayor de Blasio said in a news briefing, "There's no questions that vaccines are safe, effective, and life-saving. I urge everyone, especially those in affected areas, to get their MMR vaccines to protect their children, families, and communities." And he also noted there's no financial reason not to get vaccinated, as the vaccines are provided for free. Now, the public health emergency declaration comes after New York City health officials issued commissioner's orders last week to all yeshivas and daycare programs serving the Orthodox Jewish community of Williamsburg, doubling down on their order to exclude unvaccinated students or face violations and possible closure, first announced in December. Now, any school out of compliance will immediately be issued a violation and could be subject to closure. Well, how bad could this get? In a live science report today, experts say that the outbreak will likely get worse before it gets better. Quote, "I would expect that this outbreak is going to get bigger before it comes under control," close quote, said Dr. Amesh Adalja, a senior scholar at the Johns Hopkins Center for Health Security in Baltimore. The U.S. as a whole has a fairly high vaccination rate against measles, and the vaccine is very effective at preventing the disease. But, Adalja says, there are pockets that have lower than required vaccination rates to keep measles at bay. It's in these areas where there's potential for a lot of measles to spread. Now, Dr. Robert Glatter, he's an emergency medicine physician at Lenox Hill Hospital in New York City, agreed with that and basically said the outbreak has the potential to escalate if vaccination coverage isn't adequate in certain areas. Well, not surprisingly, not everyone is enamored with this order. Public health officials are, but not everyone, and particularly the mandatory vaccination part, and this includes the ACLU. And they said in a statement, public health law authorizes the city to take action to address public health emergencies through containment and isolation of affected people. The city's order provides that people will be vaccinated without their consent, an extreme measure which is not provided for in the law and raises civil liberties concerns about forced medical treatment. In addressing the public health concern, the government is required to pursue these least restrictive means possible to balance individual autonomy with the public health risk. In this case, measures such as a quarantine or penalties for non-vaccination may be permissible, but forced vaccination is not. So let me close out with some really good words from Health Commissioner and pediatrician Dr. Barbeau, and some of the things she had to say at the press briefing. So take a listen to what she's got to say. And when that's over, I will see you next time. Thanks a lot.
So, as was mentioned, we are in the midst of a measles outbreak. And since this outbreak began in October, we've seen 285 cases of measles in New York City. 246 have been in children, and nearly all of them have been associated with the Orthodox Jewish community. So far, 21 people have been hospitalized, and 5 have ended up in the intensive care unit. And this is the largest outbreak that we have seen in New York City since 1991. Today, as Health Commissioner, I am declaring a public health emergency due to this measles outbreak. The Health Department is ordering all people in Williamsburg to get vaccinated against measles. Taking this action is necessary to protect public health during this outbreak. People in violation of the order will be identified through investigations of exposures. Our disease detectives will check for vaccination status or immunity when tracing the contacts of a person who has developed the illness. If the department identifies an adult or a child with measles or an unvaccinated child exposed to measles, the individual or their parent or guardian will get a violation that could be fined $1,000 per instance. We've worked closely with the community, religious leaders, and schools to make sure that vulnerable people are kept safe during this outbreak and to challenge the dangerous misinformation that is being spread by a group of anti-vaxxers. Young children and people who have weakened immune systems cannot get vaccinated, so it's crucial that everyone around them be vaccinated in order to shield them from infection. While the measles-mumps-rubella vaccine is the safest and most effective method of preventing measles, it is 97% effective, meaning a few people will not be protected even if vaccinated. Non-immune pregnant women are at increased risk of serious complications, including loss of pregnancy, premature delivery, and hospitalization. I understand that parents may be afraid of getting their children vaccinated, but the reality is, as a pediatrician who has vaccinated hundreds, if not thousands of children, I know that getting vaccinated is far safer than getting the measles. The vaccine has been proven to be safe and effective in preventing the spread of measles for decades, and we have evidence to back that up. Before the vaccine was introduced in the 60s, about 500 people would die each year in the United States due to this virus. We are lucky that no one has died so far in this outbreak, but we have seen patients with severe complications who are being admitted to intensive care units, and this is preventable. We urge everyone who can get vaccinated to get vaccinated. As Passover is coming up, it's important that all New Yorkers get vaccinated, especially if they plan to travel overseas to Europe or Israel or to areas in the U.S. that are experiencing large outbreaks. The best way to protect yourself, your children, your community is to talk to your healthcare provider and get vaccinated. You can call 311 for a list of facilities that can provide the vaccine at low or no cost.
And don't forget to check us out at the website, outbreaknewstoday.com, the podcast, Outbreak News Interviews, which can be found on the website, on Apple Podcasts, Stitcher Radio, and Spotify, and the Outbreak News This Week radio show, which is aired Sundays at 1 p.m. Eastern Time in the Tampa Bay area on AM 1380 The Biz, or online streaming at 1380thebiz.com. And check out our social media presence, Facebook at Infectious Disease News, and Twitter at BackDman63. Outbreak News TV is a production of The Global Dispatch. Copyright The Global Dispatch Incorporated, 2019.